My name is Christopher Vega, and today I'm going to be doing the hamstring flexibility test. Test for any tightness in his hamstring. Is there any tightness? No. My name is Christopher Vega, and today I'm going to be doing the hip strength reduction test. I'll be testing his strength and resistance against my force. Squeeze. Right. Hello, today I'm going to be doing the hip abduction strength test. Can you please look at me? I'm going to test the strength of his legs. Resist. So like when her leg out. Alright. Today we're going to do the hip range of motion test. First we're going to test the internal and the external. And we're going to lift his knee. Internal rotation. External.
Go.
Today we're going to be doing the Trendelenburg test on my patient Scott. Can you please turn around? We're going to be testing for weakness in his hips. Can you please put your shirt in? Lift your left leg. Look for any weakness. You can put your leg down. Test is negative.
One. Go.
Hello, today we're going to be doing the Aubers test. Can you please lay on your side and bring your left leg up to your chest? Okay, we're just going to test for any tightness. You feel any tightness? No. Test is negative. Today we're going to be doing the extension strength test for the hip. I'm going to have you raise your right leg. I'm going to be testing his resistance. Alright, test is positive. Hello, today we're going to be doing the hip strength test. Can you please lift up your right leg? Okay, we're just going to test his resistance. Okay, put it down. Test is positive.
Go.
Today we're going to be doing the Patrick's test. Alright, I'm going to have my patient lift up his leg. Cross it over. I'm going to push down, testing any tightness in his hips. Any tightness? So test is positive. Today we're going to be doing the anterior and posterior test on the knee. Please have you lift up your knees 90 degrees. Okay. Then what I'm going to do is test for movement or pain on the ACL. And the PCL. Okay, test is positive. Today we're going to be doing the Lockman's test on my patient here. Alright, so we're just going to lift up his knee. And we're just going to check his ACL for a tear or rupture. Test is negative. Today we're going to be doing the Thompson test on my patient. Can you please hold your right leg and lay down? We're just going to be looking for any tightness. Okay, test is negative. Today we'll be doing the extension strength test for the hip. Okay, so I'm going to grab his leg, extend a little bit, and I'm going to hold force while he gives resistance. Okay, good force. Test is negative. Today we're going to be doing the flexion strength test for the hip. So I'm going to have you lift up your leg, and I'm going to push down, and you're going to resist it, all right? Okay, good resistance. Test is negative. Today we're going to be doing the internal and external rotation strength test for the hip. I'm going to have my patient lift up his leg. I'm going to put his leg in an external or internal rotation, and then I'm going to push his leg into the external rotation. He's going to resist my force. Okay. Then I'm going to put his leg into the external rotation, and then I'm going to push his leg internally, and he's going to resist my force. Okay. Test is good. Test is negative. Today we're going to be doing the knee extension and knee flexion test. First, I'm going to have my patient have his knee at a 90-degree angle while I apply pressure. Test for any resistance and tightness. Okay, that's good. Now we're going to apply pressure to his femur and move his ankle up. That's good. Test is negative. Today we're going to be doing the extension and flexion strength test for the knee. First, I'm going to have my patient lift up his leg and put it at a 30-degree angle. Then I'm going to grab his ankle. I'm going to have him bring his heel to his buttock. Okay, test is good. Then I'm gonna go under his leg. Then I'm gonna grab his ankle and I'm gonna have him extend. Okay. Both tests are negative. Today we're gonna be doing the varus and valgus stress test. First, I'm gonna lift my patient's leg, sit down, grab his joint line. And I'm just gonna push in, check for any ruptures or tears. Okay, good. Then I'm gonna go outside and push out. All right, test is negative. Okay, today we're gonna be doing the pivot shift test. First, I'm gonna grab my patient's leg by the heel, apply valgus stress, and we're gonna put an internal rotation, and we're just gonna test the ACL for any cracks. No cracking, so test is negative. Today we're gonna be doing the Moraes test. Get my patient's leg, put it into a flexion. Then we're just gonna do some internal rotations, test for any popping. Okay, test is negative. Then we're gonna take his leg out, and we're gonna fully extend the leg. Okay, both tests are negative. Today we're gonna be doing the Apley's test on my patient here. First, we're gonna raise his leg at a 90-degree angle, and we're gonna be testing his medial rotation and his lateral rotation. We're just gonna be testing for any discomfort. Then we're gonna add compression, and we're gonna test medial and his lateral.
What's up?
Hello, today we're doing the patellar grind test. First, I'm gonna put my hand over his patella. I'm gonna ask him to extend his knee. We're just testing to see if he can, the ability to extend his knee and any pain or discomfort. All right, test is negative.
One.
Today we're gonna be doing the ankle range of motion test on my patient. So first, for dorsiflexion, we're gonna ask the patient to bring his feet as closely as he can to himself. Okay, and then now for plantar flexion, we're gonna ask him to bring his feet as far away from him as he can. Okay, and then now for eversion, we're gonna ask him to bring the soles of his feet away from each other. And then to test his inversion, we're going to tell him to bring the soles of his feet as closely as possible as each other.
One.
Wait, what is this?
Yo.
Today we're going to be doing the manual muscle test for the ankle/foot. So first we're going to test his dorsiflexion. So first I'm going to push down. I'm going to ask him to give resistance. Okay, that's pretty good. Plantar flexion, I'm going to push up and then tell him to push down. Okay, and now I'm going to have him bring his foot out straight. And now we're going to be testing his eversion strength test by pushing in. And his exversion, or inversion. Hello, today we're going to be doing the anterior jaw test for the ankle. So first I'm just going to grab his ankle from below. Come on.
One.
Today we're going to be doing the Thompson test. First I'm going to grab his calf and we're just going to squeeze it and we're going to observe his ankle and plantar flexion. Today we're going to be doing the anterior jaw test. First I'm going to grab my patient's ankle and then I'm going to grab his tibia and we're going to draw the ankle anteriorly.